So the manifestations or symptoms of essential hypertension, well, most of them are asymptomatic. Uh, they will feel the complications of hypertension, and maybe that is the point where they come and see you. Essential hypertension, since it's a response of circulation itself causing the high blood pressure, it does remain asymptomatic in most cases. However, sustained high blood pressure eventually accelerates atherosclerosis. And actually, this is the main disease causing component in hypertensives, because this causes all sorts of cardiovascular disorders. And as I mentioned, we will revisit this table, and now we will look at this part of the table. Okay, so they are saying, and remember, if you have the time to look at the previous report, you will have a different organization of these diseases. This is very important, and hence it's important to see the historical perspective here, in the sense that some of these diseases were on top in the last report, but in the latest one, according to what I have found, this is the latest document, the heart as an organ is the number one recipient of atherosclerotic insult in hypertensive. So in hypertensive patient, eventually, as of latest data, heart gets affected most. You have left ventricular hypertrophy being the number one feature of heart damage in hypertensives. Then you have angina, which is pain of ischemia, myocardial ischemia. You have revascularization. You have heart failure. So advanced patients of hypertension go into heart failure when they present to the doctor. Then the second recipient of the injury is brain. You have strokes, you have dementia. Then look at this, CKD, chronic kidney disease. Very discussed matter in hypertension is the effect that hypertension has on kidney. Now, remember, don't be confused here. These things are bidirectional. Okay, kidney disease causes hypertension, and hypertension causes kidney disease. Okay, so let's be very clear. There are a set of kidney diseases which cause hypertension. This is not that list. That list will come up later on under secondary hypertension. This list is basically hypertension causing kidney disease. Okay, so sustained high blood pressure damages the vessels of kidney. This is what being said. Peripheral artery disease is again that thing which constant increase sustained high blood pressure within vessels triggers a response from the atherosclerosis, in the sense that there is more deposition of fat in the wall, and also sustained blood pressure challenges the elasticity of arteries, of vessels in the long term, leading to quicker decrease in their elastic profile, beating age to it. Retinopathy, so again, atherosclerosis of the retinal vessels will lead to ischemia of the retina and changes in the vision of the person. So hypertension, through its atherosclerotic weapon, causes all sorts of organ damage, and this is the way to look at essential hypertension. So it's a silent morbidity and mortality maker. Uh, Silent because it's mostly asymptomatic itself. It expresses itself via this weapon on the various crucial organs of the body.